What if I told you there's a 60-second test that could reveal if your MS is actually progressing or if you're just having an off day? Doctors use this test, but most of them don't explain what it really means for you and your daily life. So today, I'm going to break down what we know as the Romberg test. We're going to review what it actually means, how to perform it properly at home, and perhaps most importantly, what to do with the results that your neurologist or physical therapist might not be telling you. I'm Dr. Gretchen, physical therapist and multiple sclerosis certified specialist at The Missing Link. Let's dive in. Let's first review what the Romberg test means. The Romberg test distinguishes between temporary symptom fluctuations and an actual MS progression. And I'll explain further on that in a bit here. A positive test means losing your balance with your eyes closed, and this indicates specific issues within your neural pathways. Test results can help determine if new symptoms warrant a medication or changes in your medication or changes in therapy or possibly a referral to physical therapy. The Romberg test measures three things. First and foremost, it evaluates all three balance systems: our visual system, our vestibular system, which is our inner ear, and our proprioceptive system, which are the nerves in our feet and in our body that tell us where our body is in space. Number two, it specifically identifies which of those systems are affected by MS lesions. And number three, it measures how well your brain compensates when one of those sensory symptoms is compromised. Now, let's review exactly how to properly do the Romberg test at home. You're going to stand with your feet together, arms at your side, and you can be in the corner of a room or near support, maybe using a rollator or trekking poles for safety, especially if you know you don't have great balance. Let's put yourself in as safe of a position as possible. Now from here, you're going to maintain this position with your eyes open for 30 seconds. Then close your eyes for 30 to 60 seconds. And what you want to be watching for is any swaying, any directional sway patterns, consistent sways in one direction versus a random sway all over the place. And let me just tell you that some swaying is normal, even for people who don't have MS. And there's several different ways that you might be swaying. What you might notice first is your ankles swaying or your ankles wobbling. That is normal. That should be happening. If you don't notice that, then that actually might indicate a different balance issue, which we can talk about on a different day. But as you're starting to sway or wobble a little bit, you likely will first notice your ankles wobbling. That's okay. The second thing you might notice is your hips kind of swaying side to side. The third thing you might notice, if you can't regain your balance after your ankles wobble or your hips are moving, then you'll notice what we call the stepping strategy, meaning you're so off balance that you have to step in order to prevent yourself from falling over. So just pay attention. What are you noticing? Is it just your ankles wobbling? Is it a little bit of the ankles and the hips? Are you stepping? And you want to be keeping track of those things. Maybe write it down on a notepad after you do the test. And if you do step, is it always with the same foot? Is it always in the same direction? If you do have your hips swaying, is it always with your hip going over to the right, or is it all over the place? These are all really important things that can help us determine if this is actually an MS progression or if it's just a bad day. Now, a lot of people will say, oh my gosh, 30 seconds, 60 seconds, I could never do that. And if you can't, that's okay. But what I would recommend is track today. What is your normal, at least for today, especially if you've never done this before? If your normal is 20 seconds, Great. If it's 10 seconds, great. You want to get a sense of what your normal is. That's another key indicator of how we can determine if you're having a progression or just a bad day. Now, earlier I mentioned that failing the test or a positive test would mean that you can't balance for 30 seconds with your eyes closed. But there's a little more that you need to know about that. There's three specific things that we're looking for. First is unable to maintain your balance with your eyes closed, meaning you're swaying significantly, or maybe you take that extra step, as I mentioned. And if you didn't take that step, you might fall because you were losing your balance, even if you were able to be stable with your eyes open. Also, the time thresholds vary. While 30 to 60 seconds is often used as a target in clinical settings like your neurologist office or PT clinic, there's no universal standard time frame that constitutes passing versus failing. Some clinical protocols use 30 seconds. Others use 20 seconds, and research studies may use different parameters, which is why it's so important that you're tracking what your normal is. Another thing that matters is how much you're swaying. Even if someone can maintain a position for the full time, if there's excessive sway, particularly in one direction, it can be considered a positive result or failing. Now, how would you determine if this means that your MS is progressing or if it's a bad day? This is where tracking comes into play. Consistent test failures over multiple attempts or multiple days suggests true progression, while performance that improves after rest typically indicates temporary symptoms. Now, what do you do with these results? First and foremost, track changes over time to identify patterns that can help you predict a flare versus an actual progression. Number two, use results to customize specific exercises targeting your weakest balance system. Again, the options are vision, vestibular, or proprioception. And this is something that your physical therapist can help you with. And it's something that we talk about inside my online program, The Missing Link. Number three, combine this with functional assessments like walking distance or walking speed or walking quality for a complete picture of your MS. For 10 years, I've been helping people with multiple sclerosis. And what I've seen is that most people with MS have a desire to get stronger and walk better. But what they've tried hasn't worked. I've created a revolutionary program called The Missing Link specifically for people with MS, where I teach you how to strengthen your brain, your muscles, and the neural connection between the two, which is the key to seeing improvements in strength, walking, and everyday activities when you have MS. I put my right leg out to this side. Regular exercise often doesn't cut it. But it's not just exercise. You'll experience the warmth of our supportive community, where every small victory is celebrated and every struggle is met with encouragement. Check the link in the show notes to learn more about The Missing Link and see if it's a good fit for you. Okay, let's dive back in. So there you have it. Now you understand why the Romberg test is such a powerful tool in your MS management toolkit. And remember, this simple 60-second assessment can help you distinguish between actual progression and just having an off day, which, as you know, can be common with MS. By tracking your performance over time and combining these results with how you're feeling in daily activities, you'll have a much clearer picture of your MS journey than test results alone can provide. If you found this helpful, be sure to hit subscribe for more videos that empower you to take control of your MS. And if you're looking for specific exercises to improve balance issues that we discussed today, check out my program, The Missing Link. The link is in the description below. I'm Dr. Gretchen, MS certified physical therapist, and until next time, keep focusing on your functional improvements because that's what really matters in your day-to-day life with MS.